When I think about what's changed and what's changing in healthcare, I've put it this way to a group not too long ago. I said it's less personal and more personalized. Now, that comes with some good and some bad, but if you think about how things are changing and evolving, there's more digital interaction. So if you think about kind of a continuum, you have a physician and a patient face to face, touching one another. And then soon you have a patient with an iPad in front of them and a physician somewhere else. And so there's no touching, but it's face to face still, but it's a digital interface between you. And then someday you end up with a chat bot on the screen. Actually, this is happening now. And it's not even a person that's giving you clinical advice and telling you. So you've evolved from a face-to-face touching relationship to one in which another human being is not even involved. But maybe it's better. It's not yet, but maybe it will be for some things. And so the point is that on a personal level, it's less personal, but it is more personalized to what you need. It's going to be much more personalized to what you need. And so if you take that, that's probably an extreme example, but you take things like the genetic mapping, and now you have pharmacogenetics where we know specifically what drug works for you that may not work for me because we understand the genetic makeup of you and how it differs from me and how this drug interacts differently. And so it is a much more personalized healthcare. And then you take artificial intelligence reading x-rays, and I mean it becomes much better for you in a personalized way. But with all the technology and all the digital and all the computers, it is a little less personal at the end of the day. And so when I think about our business in Baptist Health, we value more than anything the human-to-human interaction in healthcare and the ministry aspect of what we're doing. And so how do we deal with all that and still stay focused on what's so important to us and that human interaction and relationship and that spiritual healing that a chat bot can't do? And what do I need to be trained in, or how do I think about my development as a caregiver in a world where my brain doesn't matter as much as it used to in terms of the technical skill? So what's important now is empathy, teamwork, good judgment, relationship building, and understanding how to use data responsibly and know what the machines are telling me and know when the machine's made a mistake so I can stop it. And that's that judgment, right? And so we've got to really focus on those soft skills and those emotional skills, because that's where the human value is going to be in that future world where machines are doing so much of that work for us. So we've got to stay focused though on how we are valuable as humans serving other humans, thinking about a future that may be dramatically different than what we look like today, and how are we going to respond, and how are we going to be relevant, how are we going to continue to fulfill our mission if the world's vastly different than it is now.